stroking the finger from the ear to the mouth, and any mother in this room will know that reflex. Sucking reflex, putting a nipple in the mouth. Snouting is stroking the nose and producing an upward movement of the lips. A startle reflex is an auditory reflex where you drop a metal weight behind the baby infant on a table. Motor reflexes, including grasping and clasping, in other words, holding onto the mother. Place hand and place foot are reflexes that were not included in this because they are not acquired until after day 14. And then orient to auditory stimuli, to visual stimuli, and following near objects and far objects. And these are standardized tests in assessing the primates. Study findings: there was a delay in the acquisition of the survival reflexes in particular in the vaccinated animals compared with the unvaccinated. Now, these are Kaplan-Meier survival curves, and I'll just describe these to you. Let's choose this one over here. These look at the proportion of animals here, 0 to 100%, left in the study over time, and time is along the bottom. And this is the time to acquisition of the reflex. So the earlier you acquire the reflex, the closer you are to the y-axis here. Here are the unexposed animals, and here are the exposed animals, and you can see there is a clear and significant difference in the rate of acquisition, or the time of acquisition, the delay in acquisition of these reflexes between those two groups. And this is seen for rooting, for sucking, for snouting, and for grasp hand, which approaches significance. And these dots represent the means between the two, and it's the significant difference between the means that is shown up here. So a significant delay always to the detriment of the vaccinated animals. And just for those of you who like data, here are all the reflexes shown, and here are those that are delayed. And you will notice that this isn't random. These occur in the survival reflexes almost exclusively, not in the motor reflexes, not in the sensory motor reflexes, but in the survival reflexes. And that reflects a part of the brainstem, which I will come to later. And I don't think that this is a coincidence at all. What other variables might influence this? When doing this study, you have to ask, well, what other things might account for these differences in the acquisition of reflexes between animals? And the two obvious ones, I keep doing that come to mind are gestational age and birth weight. Were there systematic differences between the two groups in either gestational age or birth weight, or both? So, birth weight and gestational age in the infant monkeys was within the normal range for all, both the vaccinated and the unvaccinated. There was no animal that was either premature or of low birth weight for species. And interestingly, there were no significant differences between the exposed and unexposed groups for either gestational age or birth weight. And again, interestingly, although you might have thought it, younger animals, those with lower gestational age, did not have a lower birth weight. There was no correlation between birth weight and gestational age. So we did some interaction modeling to look at the exposure, the effect of exposure, taking into account the covariates of birth weight and or gestational age on the outcome, that is time to acquisition of the reflex. So let's look at gestational age. Like I say, it's within the normal range for the species, and when we do what is called Cox regression analysis, including gestational age and exposure in the model, firstly, there is no independent effect of gestational age. Gestational age on its own does not influence the time to acquisition of the reflex. However, when you put them into the same model, you find, when you adjust for gestational age, then animals of the exposure still remains significant for the root and suck reflex and approach significance for snout. So the effect appears to be due to exposure. Was there an interaction between gestational age and exposure? In other words, were those of lower gestational age in some way more susceptible to the effects of exposure? And the answer is yes. We found that as the gestational age increased, then the effect of exposure on delay to acquisition was decreased. So animals with a greater gestational age were at less of a risk from exposure. And this was significant for root, for suck, and almost for snout. What about birth weight? In very much the same way, when we looked at regression analysis for birth weight and exposure, no independent effect for birth weight. So